Joni, well, the pandemic has left so many people struggling with their mental health, and now there's concerns this war in Ukraine is going to make that situation even worse. Hundreds of thousands of Ukrainians have been fleeing their homeland. One day life was normal, and the next they found themselves in a war-torn country. Corina Ratz is a Romanian-American therapist with the Chicago School of Professional Psychology, and she is joining me this morning. Good morning. Thank you so much for joining me. We wanted to reach out to you because I understand you're witnessing and you're hearing firsthand how this is affecting those involved. Tell us about what you've been hearing as a result.
That is correct. Thank you so much for having me again. I wish we would meet under different circumstances, but we really appreciate the invitation for us to join and speak to your audience about this important topic. I'm originally from Romania. Born and raised there, spent my early 20s there. I came to Chicago in my early 20s, right after college. And I always stay true to my love of psychology. So here I am at the Chicago School of Professional Psychology. The firsthand accounts that I'm hearing from my family of origin are really terrifying. We are looking at a humanitarian crisis. There's no other way to put it. We have over 1 million refugees as of now in Europe, all over Eastern Europe, as your images show right now. So we are looking at a true humanitarian crisis. And the way we look at it here at the Chicago School of Professional Psychology is through the lens of our students. As faculty members here, we have to guide them not only navigate and process their own emotions as they're watching this in the news, but also to guide their clients and their future clients who may be refugees that might find themselves in Chicago and all over the world, really. We have, international representation as well at the school. So we're very mindful of how this is a topic that impacts everyone.
Right.
And different degrees, obviously, but it impacts a lot of us in many, many ways.
Yeah, we keep talking about how there's food, clothing, shelter needed, medical supplies, but when it comes to the mental health needs, what do you think needs to be done, not only right now, but going into the future with this?
Absolutely. You're absolutely right. The mental health needs may not be as obvious, but they're just as important. And the first thing that we could do today, even, is for each of us to reach out to our own networks, check in with people we might not have heard from in a while, may not have spoken in a while. The other layer that complicates this further is that we are in the midst of a pandemic still. We're hoping for better days ahead, but we're still dealing with the virus and repercussions of it and how it affects our daily life. So we're strapped for resources. Our well of energy is kind of running low right now. So we have to be mindful of that. So self-care, reaching to others, connecting to others, and seeing how we can help are actually great tools. In terms of the mental health of the refugees, the most important thing will be for whoever's going to be, connecting with them to actually to acknowledge the trauma and the suffering they're going through. It may seem very easy, but acknowledging that normalizes a wide range of emotions,
right? Well,
including some of our own as helpers, right?
Yeah, absolutely. Corina, such a good conversation, and you brought up some great points. We appreciate you speaking with us this morning and also giving us tips on what we can do to help. Corina Ratz with the Chicago School of Professional Psychology. Thank you again. Great to meet you.
Thank you so much for your time. Same here, Sylvia. Have a good day.
Take care. You too. Coming up